All right, let's get into this week's Q&A. So, starting off with more oral health tips, healthier gum recommendations. So, there's something called Bite Bits or something along the lines of that. If you just look up like Bite Bits oral health or something, it should come up. If not, I can send anyone who's interested a link. That there is going to be nano hydroxyapatite, which is what 97% of your teeth are made up of. It also helps pull in calcium and phosphate ions. And that's essentially what fluoride does. So there's a lot of controversy around fluoride that you should go fluoride free. But then we did see a rise in tooth decay with the removal of fluoride. And like out of everywhere in the world, like Calgary was known to be bringing it back recently. And there are other components to why they have fluoride in the water. And, I think it's a personal thing if you're worried about fluoride. I personally go fluoride free is what I do, but I also use like this Bite Bits and everything to really help restore enamel and strengthen the teeth. And I had a little bit of tooth damage from some previous issues, and it helped it a ton. There's also something called Oral Peptide Pro, and that is a mouth rinse. I'm sure that's like, I could send a link to, but I'm sure that's sold in many different places, depends where you are in the world. But that one there contains peptides that are going to help rebuild gums, reduce gum inflammation, rebuild teeth. I mean, we know peptides have a tendency to heal things. So that is where you could look at Oral Peptide Pro. And so those are really two big combinations that can really help. And I also don't remember what I fully mentioned in the last one, but I think I spoke about the Oromir mouthwash and the Biocidin lineup with the dental side in, and they also have the probiotics. And I don't recall if I mentioned food grade hydrogen peroxide, rinsing your mouth with that, using water picks with food grade hydrogen peroxide. But you do have to be cautious because if there's not a lot of damage occurring to the microbiome, your oral microbiome, you can overdo it with things like food grade hydrogen peroxide and whatnot. And so that's why you just want to be cautious. So if you're someone who doesn't necessarily have a lot of damage or doesn't live in a very, compromised environment like mold or something like that, then I would maybe do it just 3 times per week with a food grade hydrogen peroxide. Otherwise, I wouldn't use it consistently. But if you're really sick and you have a lot of problems, you may want to use it consistently until those problems resolve. So that's something to really consider. With that being said, though, I've had more luck with oral problems using something like the Oromir mouthwash. And then I've had a few clients now really use this Oral Peptide Pro, and it can really help. So that's how you can really restore strength and reduce inflammation and everything in the mouth. But once again, if there's an oral problem, ask why. It's not because you're not using Oral Peptide Pro or using Bite Bits and stuff like that. Could be like a lymphatic problem. So make sure you're really draining the lymph system and everything. And people have gone to the lengths of injecting BPC into this area. You could also take some BPC 157 and put it in like a little bit of distilled water and then rinse your mouth with that as well. That's probably the easier to obtain. I don't know about cost effective because I don't think like these bits or whatever, definitely cost effective. And I don't think that Oral Peptide Pro is very expensive either. But if you have some BPC, you could rinse some BPC in your mouth as well for like 5 to 10 minutes. And then, I mean, like I would personally just swallow it, probably recommend spit it out. But you're also then getting the gut healing benefits of swallowing the BPC. But those are some tips that you could use for improving oral health and healthier gums and whatnot. But the person who asked this question, we know you're in a moldy environment, so that's definitely going to play a large role on your teeth. If you have dysbiosis, could eating fermented food and probiotic kefir add to the problem? So potentially, yes. So it depends what the dysbiosis is. And the person asking this, I believe you may be referring to SIBO, small intestinal bacterial overgrowth. And yes, fermented foods can feed into these underlying bacteria. And that's why I always use the term health is subjective, because something like someone on the internet, a guru will say, hey, this is really healthy and you should be doing this or you shouldn't be doing that. But it's extremely contextual and individualized. And so, yeah, like SIBO, you could definitely see an increase in potential symptoms, or you may not notice it right away, but then eventually symptoms could occur by eating a lot of fermented fruits and foods. And what I say is like, everyone gets so hung up on the microbiome. You have all these gut health specialists or whatever. And like, I refer to myself as one too at some point. And it's like, well, if the microbiome was a problem, probiotics would solve a lot of things. Antimicrobial protocols and probiotics would solve a ton of things. It's like antibiotics. If all you needed was like people say, oh, just take probiotics when you're doing antibiotics, because it's destroying the microbiome. It destroys so much more than that. It destroys like the mitochondria. And so when we look at this, if it was as simple as just wrecking the microbiome, we could take a broad spectrum probiotic and be better after the use of antibiotics. Sure, some people really do experience benefits that way, but not a lot do. I know many, many people who have done the probiotics and have not gotten better. If anything, they have become worse because they end up monoculturing the gut. So they have like too much of one specific bacteria. So that is also dysbiosis. So the definition of dysbiosis is like, let's just, something is messed up. Okay. Let's keep it really simple and say something is messed up. It's not like a specific bacterial infection. It's not like a specific candida infection, viral, whatever. It's just something is imbalanced in the gut. It's that dysbiosis. And so, yeah, like there is the potential of fermented foods. Another thing too is when you look at foods that are harder to digest, if you have this dysbiosis, you're going to have like motility issues. So the movement of the GI tract, you're going to have HCl issues. So stomach acid, pancreatic enzymes. So your ability to further break down protein, carbs, and fats. You're going to have gallbladder contraction issues. And so foods that are a little harder to digest, that it's not the food that's the problem. It's all those underlying factors, but fermented foods could lead to that. And that's where we can see maybe some excessive bloating and gas and whatnot. And so, yeah, like they could definitely feed into dysbiosis. And that's where like elimination does come in. But once again, one, we do not want to create a restrictive mindset around food. That creates a lot of psychological issues. But two, you don't want to be extremely limited to your diet. But there are so many people out there that are like, oh, since I went, low FODMAP, I've been fine. But if I eat anything on the FODMAP list, I'm not fine. Like, who wants to live like that, right? And sure, some people love carnivore. Like I love eating meat, but I would hate to do carnivore for the rest of my life just to mask symptoms. So it's like, okay, maybe there's a time and a place that you don't want to be eating these fermented foods like kefir and other types of foods like that. But doesn't mean you can't have them at some point in your life, especially if you like them. So it's, yeah, maybe right now, especially in your context, it's possibly going a little lower FODMAP and such to not feed into something like SIBO or any sort of other dysbiosis, and then eventually trickling those foods back in because they do have their benefits. But there's a ton of research out there that it's your like mitochondria, like your DNA and stuff like that, that helps with that microbiome. So when you look at like short chain fatty acid production, that's a lot to do with like the large intestine and stuff. So that's a whole different conversation. But meaning like, do we need to be eating a ton of these probiotic foods? Not necessarily according to research, but does that mean you shouldn't be eating them? No, but maybe you want to take a break from them for a bit while you address some underlying gut dysbiosis. Also, part two of the question, if you have dysbiosis, are there any healthy foods you should avoid? So once again, healthy becomes very contextual. So this is like, when we look at healthy, although this isn't like on the context of the dysbiosis of the gut, I mean, it kind of is, but everybody is educated to cook with olive oil and avocado oil. And I believe I made posts. If not, I'm going to be making posts, or I've commented somewhere that polyunsaturated fats are easily oxidized. So when they get exposed to light and heat, they're these double carbon bonds. So to keep it very simple, they're flimsy, they're very fluid. And that's what your cell needs to be made up of, is omega-6s and omega-3s and gamma-linolenic acids and everything, oleic acid, etc., because that way you can get nutrients in effectively and toxins out effectively. But when you're switching, like when your cell is going to that danger response, it switches that fluidity for containment is what I refer to. So saturated fat, because saturated fat is stiff. So you don't want to be cooking with these polyunsaturated fats. And avocado oil being marketed at high heat is a fake. They refine it, and there's all sorts of things, no matter how organic it is. If you're getting a truly cold pressed avocado oil that has not been marketed for high heat, then that's a good avocado oil. But any oil that is a polyunsaturated fat, like olive oil, it can be toxic to you, especially in higher amounts. So we are told that cooking with olive oil and avocado oil is healthy when it's really not, especially in high consumptions, because they easily oxidize. And so this is where it gets very contextual about what is healthy to that individual. So I personally believe that cooking with olive oil and avocado is not healthy to anyone because of their susceptibility to oxidize. There's that big group that is very against polyunsaturated fats, and they're not entirely wrong because they do easily oxidize. But I still think like ingesting olive oil would be a good idea, whether you sprinkle it on a salad or drink it out of the tablespoon like I do. Once again, too much olive oil though can also oxidize. We have evidence of that. So it's very contextual, the poisons in the dosage, if you will. So when it comes to healthy foods, it's like, well, what's healthy to you? It's going to be extremely individualized because, like some people demonize kale. But I've had so many people that they're like, I feel so much better when I eat kale. Like I don't eat kale personally, but it does have a tendency to be high in oxalates. So if you're somebody high in oxalates, you probably don't want to be eating that. But if you're not high in oxalates and you have the ability to excrete these oxalates that are found in the kale, then eat some kale, right? Like your mitochondria are designed to excrete these oxalates. So you shouldn't necessarily have to worry about oxalates unless you're just like pounding back a bunch of kale. Once again, the poison is in the dosage. And so when it comes to like healthy, I know it's not really answering your question. It becomes very individualized and very contextual about like, okay, what's healthy to you? And so like some people, like I can eat gluten, no problem. Some people can't eat gluten, right? So it's just depending. But Yeah, if we had to look at it from a society perspective of what things are listed as like healthy, yeah, so kale is a great example. Maybe don't eat kale, especially if you have, fungal or mold exposure and whatnot, high levels of oxalates. For the fermented foods, like you'd mentioned, and stuff like that. So there are a few things out there, avocados and histamine. They refer to avocados as a superfood. So, but they're very high in histamine or can be histamine, depends on how ripe they are, just like bananas. So all these things, like these healthy foods, can definitely have some sort of impact. Does that make them bad or not healthy? No. It's once again, it's contextual and nuanced. And if you can't tolerate an avocado, you have underlying issues that need to be addressed. Sure, there may be some people out there with genetic components that they just very poor DOA, whatever, but it's usually a gut lining issue and cell danger response. You know the drill. So it's yes, there are probably some healthy foods that should be avoided while you're healing, but the goal is to get those back in. And that's one way to determine. Like I've had people where maybe their energy hasn't improved much, their brain fog hasn't improved much. There's some other symptoms, but all of a sudden they're able to tolerate more food or different types of foods that they couldn't tolerate before. So that's a good sign, right? So that means you're moving in the right direction. So yeah, you could start eliminating some foods to see how you respond, whether it's high histamine, high oxalate, high FODMAP. You know, there's several types of diets out there, and then to see how you do, and then as you progress through the healing journey, slowly trickle these foods back in. Because yes, avocados are very healthy. Bananas can be great. So there's a lot of benefits to these foods that may cause you problems under certain conditions or certain scenarios. So you just got to correct that, and then you can tolerate the food. How can I improve energy levels without caffeine? There are a bajillion ways to do this. So, number one is look at it from a recovery standpoint. I was really always in the realm of like stimulatory, need to stimulate. And so, whether it was caffeine, whether it was like nootropics, modafinils, whatever, Dexedrine, Adderall, well, look at it from a recovery standpoint. How can we recover? How can we restore these neurotransmitters? Because when we look at energy, it's going to be a lot like it's the cell, because if you're in that cell danger response, so I guess this is very contextual because it's like, how can I improve my energy levels without caffeine? Well, if you're in such a severe cell danger response, remember the cell is pulling back that energy production. It's not creating that ATP to be used as energy. So that's where a lot of your energy problems are coming from. And so like your only way of getting energy is cortisol, and you've depleted all your cortisol because you've already depleted all your neurotransmitters like dopamine and acetylcholine. And so you need that caffeine to raise those cortisol levels in order for you to get some energy. And that's why like I'm not a huge fan of adaptogens anymore. I do think there's a time and a place, but when someone has an energy issue, I go for more for neurotransmitters. I go more for healing the neurons in the brain, and then that way they can produce neurotransmitters. Because you look at cortisol as your stress hormone, I think it should be viewed as a nutrient partitioning hormone. Credit to one of my old mentors. I think it's much better looked at as that, so we don't demonize cortisol. But I want better dopamine. Dopamine is your healthy stress response. So the more dopamine you have, the less stress hormones you're going to use. Now, you can have adrenaline and everything like that. 50% of that adrenaline needs to be metabolized through the gut, which can feed pathogens up to 10,000% more. So you don't want to be utilizing adrenaline. So I focus more on things like dopamine and whatnot. But once again, very contextual. Like this past week, spoke with a client where she has very obvious symptoms of a slow catechol-methyltransferase gene. So COMT gene not only helps flush estrogen, but also helps flush dopamine out of the brain. So we tend to see high levels of dopamine, like we saw this on her organic acid test. And so that COMT being slow, well, we probably don't want to promote dopamine. This is maybe where we do want to look at nourishing the adrenals, right? So it's like, man, the stuff, it gets so annoying some days. I wish there was just like one simple answer to everything. Not that someone shouldn't be doing adaptogens like cordyceps and rhodelia and ashwagandha and stuff like this, but we do have research too that you doing adaptogens for too long can actually reduce your ability to manage stress. So we've seen that. So that's why we don't want to stay on adaptogens for a long time, figure out why we don't have the energy. So we'll look at a cell danger response and look at neurotransmitters. So how can you improve without caffeine? It's very person dependent. You got to be very careful because you don't know where certain neurotransmitters are at. And I suppose the easiest way to figure out where your dopamine is at is, I call it the Eeyore mentality. So if you have high dopamine, you're more like Kramer from Seinfeld. If you have low dopamine, you're more like Eeyore. Now, that's not always the case though, but in most cases it is. And so look at dopamine as the get stuff done neurotransmitter. It's your motivation neurotransmitter. So the more dopamine you have, yes, it has so many roles, muscle contractions and all sorts of things, right? But if you have a lot of dopamine, you're going to be much more motivated to get things done. That's why like people take Adderall and all of a sudden they're getting a lot of work done. But remember, you need the resources. So if you have a bunch of dopamine, you're going to be expending a bunch of resources, especially something like acetylcholine. So it's like, okay, try to figure out where your dopamine's at first before you try to mess with your dopamine, but start with something like alpha GPC. Alpha GPC can be so great because it does have a bit of stimulatory effect in, like, I'll just say a healthy manner, but it's a building block for acetylcholine. And that acetylcholine is what's going to help regulate dopamine, learning and focus, transition of brainwaves. It's also very, very important for your vagus nerve, for vagal tone. So alpha GPC can actually help with things like constipation or digestive issues and whatnot, and actually calming you down, like activating that parasympathetic nervous system. So alpha GPC would be a great place to start. Most people are pretty safe with that. I don't believe a lot of people have elevated levels of acetylcholine because we burn through it so much on a day. Like right now, I'm just burning through so much acetylcholine. I usually take ketones before I speak a lot to fuel this kind of stuff, and obviously alpha GPC, but something like alpha GPC and then compound 7P. Compound 7P will reduce the breakdown of acetylcholine. So compound 7P can be really great to consider as well. And then like looking at something like cerebrolysine. Now, unfortunately, cerebrolysine would have to be an injection because it has to cross that blood-brain barrier, but cerebrolysine can really balance out neurotransmitters. Once again, though, very individualized because some people could get stimulated from something like cerebrolysine. So like that's the recovery aspect. J147 can really help repair the neurons, help with the prefrontal cortex. So there's a lot of benefits to just promoting recovery and balance rather than stimulatory. The problem is, though, we are in such a stimulatory society, which I've mentioned several times, that we are trying to constantly match this heightened sense of stimulation. And so it's like, okay, it's not good enough to be just clear-minded and focused. It's like, no, and I'm so guilty of this. It's like, no, I need to think the best I've ever thought, and I need to be firing at 100,000 milliseconds, whatever, right? It's like we just want to match this. It's that dopamine. We're trying to match that level because we're in such a stimulatory society. So it's like, okay, we could achieve a lot of great focus and clarity and energy. And yeah, you're using recovery and alpha GPCs and things like this. Modafinil is on the very extreme, but that's promoting a ton of dopamine, so much more stimulatory. But it's like, okay, that's probably good enough, but you want more. And I'm so guilty of that. And it's just like realizing that even on a day where I don't feel extremely stimulated, that I'm super good at what I do. Like I can get a lot done and all this kind of stuff, but we're always reaching for that more. And so this is where you need to be able to repair the damage that is caused from always reaching the more. Like we know caffeine has been linked to neuron damage just from excessive dopamine release and cortisol release, but oh, well, then that cortisol shrinks the hippocampus, and like I could go on. Then we're thinking more with our amygdala. We've enlarged the reptilian brain. There's things like that. So think of recovery rather. That's why meditation has so many benefits, because it's calming the brain down. And meditation could be as simply as just like breathing, like counting your breath. It's not about like going off into a different universe and humming kind of idea, like people think it is. So there's a lot of definitions of meditation, and like true meditation. Yeah, I don't think I know anyone. Well, I know one person personally who can achieve true meditation, and that's but it's like I said, looking at ketones for energy, J147, cerebrolysine, alpha GPC, choline CDP is another one as well, compound 7P for reducing the breakdown, things like that. So those are the kind of things that I would suggest, and I'm going to work on posts to for that kind of stuff, to help with that, because like, not that coffee is bad, but we overconsume coffee, and that's what makes it bad. Poison's in the dosage, right? Any tips for reducing inflammation in joints for someone in their 40s? So this is I could say a million things, and I'm kind of running out of time here, but you could look at dragon's blood, potent anti-inflammatory. You could look at injectable glutathione. Once again, that can bring down a lot of inflammation. Just be cautious with a detox effect and whatnot, especially if you've been exposed to a lot of mycotoxins. You could look at your basic turmeric and curcumin and everything. Your BPC and TB500s can work really well. KPV can help. Those peptides can also help, like inhibit NF-kappa B, which is like a master switch for inflammation. I find that's 50-50 though. GHKCU has been shown to help reduce inflammation. You could look at low dose naltrexone. You'd have to talk to your doctor. Well, no, actually, there's tons of sites on the internet. But low dose naltrexone can inhibit like interleukin 6 and stuff, which can be associated with the like inflammation of the joints, like arthritis type stuff. So there's a lot out there. This is another one that I should make a post on. There's a lot out there, but your traditional BPCs and TB500s are like usually so safe for everyone that you could really consider that. Now, I would say in the case of joint inflammation, I would say injection form, but you could also oral would BPC would be fine. You can't do oral TB500, doesn't work. I don't know about oral GHKCU. I don't know the efficacy of that. I haven't looked into it enough. I mostly just have people inject GHKCU, but also like oral dragon's blood as supplements, turmeric. That heavy nature, a lot of people seem to like that heavy nature. I'm 50-50 on it, but a lot of people seem to like heavy nature. So there's quite a few anti-inflammatories out there that you could consider to help reduce that joint inflammation. It could even be just something as proteolytic enzymes like serrapeptidase, nanokinase, and stuff like that, because they'll break down the inflammagens in the joints. So hopefully that was enough. That was a lot, right? I'm just got to wrap this up here. So thanks again, you guys, for always tuning into these. I really appreciate it all, and I'll see you in the next one.